Hi everyone, this is our quick 2019 budget wrap-up. We've just come out of the budget lock-up, so the two lock-ups, one at Treasury and one at Health. To be honest, it's going to take us a little bit of time yet to unpack some of these initiatives, so I want to just report with a little bit of care. Some of these initiatives are going to be brand new money. Some of these initiatives are going to be money that's already been announced. And over the course of the next little while we'll sort some of that detail out. But I thought it was important to get you, as best we can, the quick summary of what we think the major initiatives are in this budget. So we've already heard, if you've heard the Treasurer's speech, that the headline number the government will be using is something like $736 million in total. Against those caveats that I've warned you about, we'll work out how much of that's new money and how much of it is old money, but it's old commitments, but a very welcome investment nonetheless. They're really important measures. I want to go through the measures specifically, and some of them will be quite large and some of them will be quite small, but as I said, at this stage, this is what we've worked out from the budget. So a large focus on youth and Indigenous mental health and suicide prevention. Some of the initiatives, $461 million for a national strategy to prevent suicide and to build mental well-being. The government again are calling this the single largest investment in youth suicide prevention in the country's history. $15 million to create new information systems, and you'll know that one of the things we've been lobbying for is better data collection, particularly in the suicide area. I understand that's mostly investment that will be made to the Institute of Health and Welfare. I'm not exactly sure what this will be yet, but a suicide prevention coordinator will be established within the Prime Minister's office to provide a whole of government approach to suicide prevention. So that's an important new initiative, and they'll take some of that funding. The specific programs, if you like, in this sort of domain are focused in three main areas. The first is further investment in Headspace, including $111 million for 30 new services around the country, and I understand there'll be a particular focus on regional and rural areas. $152 million will be spent to target waiting times and to focus on areas where there are already substantial waits. $110 million on early psychosis youth services at 6 Headspace centres to support young people in their early stages of severe mental illness. And a $2 million investment for young ambassadors to keep promoting health-seeking behaviours. The second tranche of money in that suicide prevention and youth mental health space is the Indigenous suicide prevention. $14.5 million is the headline figure. In that space, we'll see $4.5 million to Indigenous leadership to create a national approach to culturally informed and place-based care. $5 million for young people to participate in cultural arts and healing programs. $3 million for a Centre for Excellence for childhood wellness and to assist children and adolescents affected by early trauma. And $1.2 million for the Red Dust program to deliver social and emotional wellbeing specifically in the Northern Territory. The third part of this measure then is childhood and parenting support, headline number $11.8 million. This will be focused on primary prevention and early intervention. $1.5 million for the Raising the Children network to help parents recognise when their children are struggling and to offer parents advice about what to do when to help. $2.5 million for the Smiling Minds program to help children in schools to learn to manage their mental health and well-being. $2.8 million for Batia to help to amplify the voices of peers and to encourage others to seek help. As we know, Batia have got a very active peer ambassadors program. An additional $4 million to Kids Helpline to help them close the 24/7 demands, or to close out the 24/7 demands. And $0.6 million, so $600,000, for a trial of peer workers in the Wayback Suicide Prevention Service. And I know that peer work will be something that's important to people, so there's some specific spending there. Additional projects out of the Community Health and Hospitals program, the CHHP, include spending on community mental health, $275 million in fact for community mental health initiative, focused more on adults and families and workers. So this is now moving out of the youth and suicide prevention space. Specifically, these initiatives will be community mental health centres. So this is the notion of adult hubs, and I think this is a really interesting and important initiative. There'll be the trial of 8 coordinated mental health hubs nationally. I don't think detail yet about where exactly, nor exactly what those will comprise, but they're meant to be, the idea is they'll be walk-in centres offering a range of services, triage, treatment and referral, and they'll be alternatives to emergency medical departments with a welcoming front door, as it's described. I understand that these will be commissioned by primary health networks and possibly in consultation with the state LHDs and other services. So that's an important, I think, new direction for government to be taking us in that idea of adult hubs. We heard in the news already this morning announcements around residential eating disorders, $63 million to support 6 new centres coordinated nationally, and I think the ACT and WA have already been announced as sites for those. Mentally healthy workplaces, another area where we've been doing a lot of advocacy. There'll be $15.2 million invested. 11.5 for the Mentally Healthy Workplace Alliance, Mental Health Australia, along with the Business Council of Australia and the ACTU and Beyond Blue and many other organisations are part of that alliance. We'll see $11.5 million invested there. $2.5 million for the Blue Hub to boost the mental health and wellbeing of our police forces, and $1.2 million for Mates in Construction to continue to support their important work, particularly around a national framework. Some investment in perinatal mental health, which I think is another important investment at $44 million. Funding to a range of programs to support the mental health of new and expectant parents. $5.5 million is going to be invested in natural disaster support, support for the communities of Queensland, Victoria and Tasmania, who've been, as we know, affected by national disasters. And then a series of specific community projects, which while smaller, I'm always cautious to report programs as small because they're often very significant to those involved. $7 million to the Mind Gardens Alliance, I think led by the Black Dog Institute, which will be research-based and built around comprehensive brain disorders, an integrated clinic based in Sydney. $1.2 million for the establishment of non-clinical suicide prevention and recovery centres in partnership with Roses in the Ocean, another Mental Health Australia member. $2 million for the HALT suicide prevention workers in northeast Melbourne, and $6 million for the Midland Mental Health Emergency Centre to provide care around the Swan and surrounding areas, with a whole range of smaller projects then coming out of that CHP. So as I said, that's the sort of quick summary that we can give you based on our initial analysis of the budget papers. There'll be more to come. As I said, specifically we'll do some more analysis around how much of that investment is new and over what period that investment is being made. But I think you'll agree there are some very important initiatives coming out of this budget for mental health. And we'll also do further analysis and around what comes next, because you've heard us saying for a long time, we really need to have both the government and the alternative government moving into an election cycle with platforms that we can identify and analyse. I think you'll all agree. There's a lot left to be done. These initiatives are welcome, a lot left to be done, and we'll get back to you with more information about how we'll draw on your help to prosecute those arguments into the future. But for tonight, that's the 2019